Sure, in the room, I'll just do this with you. Okay, so same thing. Of course, this will be up like this, you know, so mom can't see anything. Dad may look over.
That was mistake number 1 for me.
And I'm going to put this on my right side because I like to be able to get to my bovie with my right hand.
No, you just see like organs that you didn't know. You don't know what they're doing if you like you've never been exposed to.
And
it.
this is really nice if you want to use these. Really
And I looked
nice
over and I was like, bad idea.
You know what I'm saying? So if you want to put,
You have enough on this?
not really, no, I just want you to get these through. And then we'll probably have bags, like I said, to catch all the amniotic fluid, so this would probably be in with the assistant, but we don't, so we're just going to leave it here.
Just like that? Or
Yeah. So what I want to do here is, remember the surgeons like to do that thing where they, do this thing. So now I can determine how much I have, which is good.
I don't even need that.
Nope. Right, I need some sponges and a drawing pen. Okay, so yeah, and then, you know, it just depends on how you look at it. You know what I mean, John? Like, if you feel like this is all going to slip off, you might want to clamp it. It's really going to be up to you. Most techs do clamp. Just kind of depends. Okay, still waiting on the sponges. She's really wet. She's covered in betadine. Can't draw on a wet surface, so. Yep. No.
No, you want.
Not up on a belly case. Only left. Try to get those up to your surgeon as fast as possible. You can always go get your back table later. Okay, so if this is her pubic bone right here, this is going to be really low. Okay, it's going to be just like right there. So if you wear the tiniest bikini, it's not even going to show. Well, let's hope so. I'm going to go up a little just because sewing this back together is going to be really hard over there, but they would go really, really low. So usually a C-section drape looks like a triangle, like this. Kind of looks like that, and it has stickies, and we stick it down, and then really that's all we have. But I'm going to make, and it is about this wide. So I'm going to make, and this you know what this incision's called? Starts with a PH. Fan and steel. PH. PFANNSTEIL. Fan and steel.
PF?
PF, yep.
Surgical class?
Yes, go ahead.
All right, patient is Taylor Swift. Procedure is a C-section. The operative site is the abdomen. There are no abnormalities. Antibiotics were given. There are no implants. Ready to go?
Yes. Okay. Let me have a teeth, forceps with teeth. All right, Taylor, you feel that? You feel any of that? They'll usually ask for something with teeth, and they're going to get a good little pinch on their skin. And if she does, you know, so they'll start like, you know, up here she can feel. Anything below the belly button down, not feel, right? So they'll start up here, and they're like, if she doesn't feel that, then they're good to go, right? Because then she's not going to feel anything down here. But if she's like, yeah, I'm nice and numb, but then she's like, oh, I feel this, then they might just, we might wait a while for the patient to get numb, and then they'll try her again. They're going to keep asking her how she's doing. And once she's really numb, I'll be like, okay, good to go. Okay, now I'll take a 10 or a 20. Okay. And I haven't done one of these. Let's hope I don't forget. That's about good. Okay, move back. Okay, what do you got? Some Goulet's or Army Navies or something?
Army Navy, sure.
And this is just depending on the surgeon, of course, as always. Okay, so cut through the fat there under the skin. Okay, now I got muscles where they're going to try to cut it right down the linea alba so they can just split the muscles apart, okay? So what would I use for a muscle? Okay, wrong hand though. That's my working hand. So just try to grab these together. And we'll
Okay.
you got both hands, so just use them. Okay, so I'm gonna go through the muscle here. Make a nice fine line down the middle of the rectus abdominis. And then I'm gonna pull these apart. Pull these apart, come out. Pull them apart. Okay, what we got, no, that's fine. Go ahead and put those back in. Okay, so go this way now. Yeah. Okay, let's see. Let me get that rich. And let me get a, okay, so this is peritoneum, right? So everything's gonna go moist after this, right?
Okay.
Okay, let me get a couple of Kelly clamps. Okay, let me get a blade.
Fresh blade.
Okay, hold this. Yeah, take mets. You always have those ready. So these are kind of the same kind of stuff. Okay, so right here now, come out with those. Can we get a bladder blade? So hand this off, just stick it like that. So stick it like that. Okay, so there's that, and there's that. Okay, so you're holding this now, Jeff. Okay, all these laps go wet, right? Everything goes wet once we're in the abdomen. Okay, so the uterus is, okay, we can't do this here, but you know, it's basically like this, right? It's just bulging, right, like right here. You know, we're not going way deep down, like we're trying to find other stuff. So just try to imagine, because, you know, this is hard, we can't stretch it. So try to imagine this is way bigger and rounder, just bulging out of there. Okay, so that's the head. Okay, so uterus is right here. Okay, we're gonna nick the uterus, and we're gonna make sure right here, I'm gonna make sure that bladder is, this bladder flap that comes up by the uterus, I've detached it, and she's securely got that bladder out of the way. Okay, so now I'll go ahead and take a knife. Okay, so wherever that inside knife was, keep it up on your mayo, because we're always gonna make do the uterine. The skin knife is good to get rid of. Keep that. Okay, now I'm going to extend the uterus, right? With what? Yeah, Lister. Okay, yeah, so he handed it to me just like that. So this piece here protects the baby's head. So I'm going to extend this. Okay. At this point, you know, you would have suction bulb in your hand. And I'd be kind of moving that out of the way. Now, also, I told you do this every time, sorry. Suction. We would have suction up and ready to go because we just have amniotic fluid going all over the place now. As soon as I made that incision with the knife, somebody's got to have this right up to that incision to be sucking out the amniotic fluid. Sorry, it's been a while. Okay, so we got all that sucked out, and now come out here. And here, just throw them at him. Yeah, get rid of those. Okay. And at this point, I've extended the incision. He's got that bulb ready. I put a towel up. I'd kind of be doing that and having that ready for the baby. It's not like you have to, but it makes it less slippery to have something dry up here. Okay. Especially all of that amniotic fluid all over the place. Okay, so you're gonna push here. So she's pushing that baby, and I'm grabbing the head. This is where if it does get stuck, we might be able to use the kiwi. You know, the suction where you pump it up, and you'll be pumping it up into where it gets in, the little needle gets into the green, and then you know it's got enough suction we can pull that baby. So they grab that head, man, and they're like this. They're just pulling it, and then bam, we got the head. So
A little happy baby Christmas.
yeah.
I'm free.
Okay. So you're gonna have that right there on standby.
Okay.
So right now, we're pulling it out. We're getting that baby out.
I'm not sure.
Okay, I'm just gonna And then you would have a couple clamps, you know, ready to go. So
What's
babies,
Miss Emerson, what's the bulb syringe called?
bulb syringe. Okay, baby's out. I've plopped it there.
Yeah.
Thanks.
Still attached. Okay,
Thank you.
I'll excuse it for
okay.
you.
Mayo clamp, Mayo clamp, and Lister bandage scissors ready to go. Okay, so clamp, clamp, cut. Okay, so I've cut that, and now whatever, rubbing baby, cry. Okay, so you know, here's baby. Actually, we wouldn't even take that. We'd just be like, here's the baby. Okay. Bring it over because she's not going to come up with a sterile field. And that's all sterile, so you can touch it. Okay, and then this is, you know, you'd be wiping up all the stuff and getting rid of that thing. Okay, at this point, right now, and this is when they're probably, you know, they might even have this uterus up and out right here, okay? So right now I need the cord blood. First thing we're gonna do, but it wouldn't hurt, you can bring that, I don't care.
All
Just
right.
have that thing ready to go.
Just open it up.
Yeah, and they may milk it or you might milk it, but you're gonna milk this thing. You know, you're gonna go like this with your fingers, and you're gonna get all of this blood out of the cord. And once that tube's filled up, you're good. Then they're gonna put the clamp back on. And this is when they're like pulling on this. So give me another clamp. Okay, might not be big enough to get around the cord, depending on the baby's cord. So this is when you have, you know, your thing ready for the placenta. And I'm gently pulling on this placenta. See how fast, that's pretty much how fast a baby comes out. I mean, it's, okay. Yes.
Put the blue towel off the field.
Yeah.
All right, and then with clamps and all, they just throw it in there. Okay, at this point, there's blood, and they're just throwing big bloody and you're just getting as many wet laps up here as you can. Okay, I'm just gonna pack it in there. Okay, dry one here. Just hold the uterus there, just like that. Okay, and these are just, if you can imagine, coming up, they're just wadded up into a ball of blood. Just throwing that. Okay, sponge stick. You're having those Penningtons ready to go, another sponge stick. Some doctors use a lot of sponge sticks. Let me slap that in my hand. Yeah, that's what I like. Thank you. Look at that. It feels good to feel it in your hand. You're not like, it feels fumbly and weird if you don't. It just feels odd. Okay, have those Penningtons ready? Let's go. Okay, so this is where they're just gonna put them all along. This is what we were talking about. But there's gonna be like 1, 2, 3, 4, probably 8. Who knows? But I only got 4. So that's what we're doing. Okay, so these are just gonna hold the edges of the uterus. I'm gonna keep that wide open. And then now I might be doing some serious bovying.
I'm gonna hold these or just let them lay?
Nah, they can just lay for now.
Okay.
Bovying, and then it's just, reality is a lot of sponges. And some docs, you know, you might have like some blood right here and you put it back up and they're like, they just throw it at you. Like they want a fresh sponge every time. They wanted a nice dry sponge. Okay, so blah, 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 you're getting all that coagulated, and then you're getting your suture ready.
Okay.
Okay, because you want to get that suture off to them, and you might be holding that bladder blade. You know, they might not be using it, but they might, just to keep that bladder out of the way so they don't sew it, they don't touch it. So I'm going to go ahead and grab this bladder blade and stick that in there. The uterus is here. I'm controlling bleeding. I made sure all of the placenta is out of the uterus, and then I'm like, you know, before you know it, they're like, I'm ready to sew. And they are ready.
They're catheterized when they're doing a C-section, right?
Yes.
Because when you push down on the bladder, there's a chance that they could.
They are catheterized, always.
Okay.
You missed it. I said that at the beginning.
I'm sorry.
It's okay. They are, and it'll be hanging probably on your side, so just be careful
Okay.
about that. Okay, I'm ready to sew uterus.
Double grant.
Yeah,
Give me
that's
that
good.
look, Jess.
You want a Bonnie or a Russian?
I'll take a Russian. Okay, so he loaded this pretty well. I mean, the needle's going to be way bigger than this, just about 3/4.